year 2025, which has the theme of accelerating reduction of maternal and neonatal death in the Americas region. Welcome, everyone. This year, on World Health Day, imposes a timely chance to reinstate our commitment with a comprehensive perspective to battle maternal mortality with a focus on reproductive health and women so they may decide whether they have children or not, protecting in this manner their own health and their children's and by reducing risks. Welcome. If you could please share the slide on logistics and language.
Mention that all the presentations will be translated in 4 languages. Nuestras presentaciones de hoy van a ser traducidas simultáneamente.
Today's presentations will be translated simultaneously into 4 languages.
En la parte inferior de la pantalla van a poder elegir el mundo.
On the lower part of your screen, you may select the globe icon to select the language that you would like to listen this webinar in.
Select the language where you want to listen and learn and participate in this webinar. You select, please, your language now. Con mucho orgullo, iniciamos y con mucho entusiasmo.
Very proudly and quite enthusiastically, we're kicking off this webinar, and we invite our Assistant Director, Rhonda Seeley Thomas.
She is a national from Antigua and Barbuda. She received the medical doctor degree from the University of West Indies and a master and a doctorate in public health from Jamaica. She served in her country for many years working in public health, and she now served as a chair. She was serving as a chair for the PAHO regional validation for eliminating vertical transmission of diseases from mother to child, HIV and syphilis. And now she is our director. We invite her to have opening remarks. Please, Dr. Rhonda, welcome, and the floor is yours.
Thank you, and good morning. Minister of Health of the Republic of Nicaragua, Carlos Jose Torres. Minister of Health of St. Lucia, Moses Jean-Baptiste. Minister of Health of Peru, Cesar Henry Vasquez. Minister of Health of the Oriental Republic of Uruguay, Cristina Lustenberg. Ms. Tracy Baid, President and CEO of Engender Health, a leading global health civil society organization, World Health Organization and Pan American Health Organization colleagues from the technical teams of the Ministries of Health, other agencies of the United Nations systems, partners, civil society organizations, and the public excellencies. Good morning, and welcome to this vital and inspiring celebration. It is both an honor and a privilege to be with you this morning as we gather to commemorate World Health Day 2025, celebrated each year on April 7th. This year's theme, Healthy Beginnings, Hopeful Futures, Accelerating the Reduction of Maternal and Neonatal Mortality in the Americas, reflects our shared commitment to ensuring a better, healthier future for mothers and newborns across our region. While we have made remarkable strides in improving health outcomes in certain areas, it is undeniable that we continue to face significant challenges in addressing preventable maternal and neonatal deaths. Permit me to remind you of the urgency of the situation. Since 2015, the decline in maternal mortality rates across the Americas has slowed significantly, and the COVID-19 pandemic brought additional setbacks, reversing the progress that we had previously achieved. Every 2 minutes, a woman dies from causes related to pregnancy or childbirth. Additionally, in Latin America and the Caribbean, approximately 7,200 women lose their lives each year to preventable complications associated with pregnancy, childbirth, and the postpartum period. Unfortunately, maternal mortality continues to disproportionately impact women in rural areas and in low-income communities. Regarding neonatal mortality, in Latin America and the Caribbean, a startling 57% of deaths among children under 5 occur within the first 28 days of life. Quality neonatal care is not only vital to protecting the lives of newborns, it also lays the foundation for hopeful futures for our region's youngest inhabitants. Ladies and gentlemen, these statistics are heartbreaking, but they're not inevitable. Quality maternal care, access to modern methods of contraception, and fighting inequality in healthcare access have the power to save lives and transform futures. We must also ensure that prenatal and postnatal care, along with other healthcare services, are delivered with dignity, respect, and inclusivity. We must work tirelessly to ensure that every birth happens under the best health conditions, with access to quality, respectful, and timely care. This is not just the responsibility of health systems, it is a shared duty that involves governments, the private sector, civil society, communities, families, and each of us individually. In response to these alarming trends, PAHO's director, Dr. Jabas Barbosa Jr., issued an urgent call to action in June 2024, rallying efforts across member states and engaging key partners to accelerate progress on maternal and neonatal health. Additionally, during the 2024 World Health Assembly, governments united to reaffirm their commitment to improving maternal and newborn survival, expressing a collective determination to address these critical issues. This year's World Health Day theme aligns with PAHO's ambitious Zero Preventable Maternal Deaths campaign, and with global initiatives such as the Every Newborn Action Plan and the Strategy to End Preventable Maternal Mortality. Regionally, it builds on the Sustainable Health Agenda for the Americas, the Regional Action Plan for the Health of Women, Children, and Adolescents 2018 to 2030, and PAHO's strategy to accelerate the reduction of maternal mortality, which focuses on strengthening primary health care. PAHO has prioritized 12 countries that account for 90% of maternal deaths in the region, while remaining fully committed to providing technical cooperation to all member states. Even in countries with low maternal mortality rates, there are vulnerable groups who require focused and urgent attention. The health of mothers and babies is the cornerstone of thriving families and communities. It is the foundation upon which hopeful futures are built, not just for individuals, but for societies as a whole. The time for action is now. We can, and we must put an end to preventable maternal and neonatal deaths. Together, let us rally behind PAHO's call to ensure equitable access to quality care for women and newborns, particularly in the poorest and most vulnerable communities, including in emergency settings where the risks are greatest. But saving lives is just the beginning. Beyond survival, we must invest in the long-term health and well-being of women. Every woman deserves access to health providers who listen to her concerns and address her needs, particularly in the months after childbirth, when far too many still lack critical support. Thank you for your continued dedication and partnership in this vital endeavor. Together, we can make a lasting impact on women's and neonatal health and well-being in the region. I wish you a very successful webinar and thank you for your kind attention.
Thank you very much, Dr. Thomas. Was your inspiring words. Thank you very much. We will start the webinar Vamos a comenzar ahora el webinar y voy a cambiar a español.
Now we're kicking off the webinar and I'm switching to Spanish, reminding that access to reproductive health services supplements outcomes in maternal health and the capacity of women to plan their lives, their health, and the capacity of action and empowerment of women and girls is the missing piece, though fundamental, to tackle and reduce maternal mortality and to achieve health for everyone. This is why we now invite our colleague, Tracy Bird, who will now present to us. Tracy is chair and executive director to the Gender Health Organization, which leads on most health and reproductive health issues, as well as neonatal health and gender equality, via locally sourced development and authentic alliances. Tracy has more than 30 years' experience working in sexual and reproductive health and law globally, including the African region, as well as Asia and Latin America, along with the United States. We have almost 500 people listening in, and we are very happy to be able to share with them. Tracy?
The floor is yours. Thank you.
Thank you very much, Rodolfo and everyone. I hope my screen is up and that people are able to see it.
It's not yet in the presentation mode.
Let's see. There we go. Thank you for that note. Excellent. Good morning, everyone. And thank you so much to PAHO for bringing us together on this really important World Health Day. It's an honor to join you and to speak about maternal and newborn survival and the broader vision that we must embrace if we're serious about making progress. A vision that weaves together health, equity, and rights. I'm Tracy Baird, and I'm president and CEO of Engender Health. As Rodolfo said, we work globally on maternal and newborn health, reproductive and sexual health and rights, and gender equality. Professor Mahmoud Fatala said that mothers are not dying because of diseases we cannot prevent or treat. They are still dying because societies have yet to make the decision that their lives are worth saving. This quote is decades old. It has inspired me my entire career. And yet in 2025, it's still true. In Latin America and the Caribbean, and in fact, all over the world, women still die from pregnancy-related causes. Newborns die. And these deaths are not inevitable. They're political, and they reflect societal choices. There's a wide range of gaps in the services and the policies and the community engagement that we offer, and that in terms of the health outcomes that people achieve. We see gaps in health outcomes. We see gaps in service delivery. We see gaps in training and financing, and gaps in respect and autonomy. And we know, everyone on this webinar knows, that these gaps are wider for people who are poor, young, indigenous, Afro-descendant, LGBTQ+, or living in fragile or rural areas, especially areas that are devastated by climate crises. And these gaps are compounded when access to sexual and reproductive health services like family planning, safe abortion, and post-abortion care, and access to maternal health services are denied. So when we address gaps, we want to understand their root causes, right? We know we have to get to the core, to what's really causing this whole range of issues that we see and we deal with in our work and in our policy. Beneath these gaps, we see issues of stigma, We see power imbalances, inequality. We see systemic disrespect and the denial of rights. We cannot improve maternal and newborn survival and the rights of women and girls around the world unless we tackle the systems that block access to care and deny reproductive autonomy. So what do we do? At Engender Health, we take an integrated approach, and I know many of your national and regional and local programs do the same. These integrated approaches look at individuals in the context of their communities. We look at health systems and the institutions that support the people and communities, and we look at national and regional policies, including financing. Because you don't solve a systemic problem with one isolated intervention. We have to look holistically at integrated solutions. And we know that health must be rights affirming, that equity must be intentional, and that dignity in healthcare is non-negotiable. So how do we prioritize? How do we prioritize for change and action as we kick off a World Health Day that leads us to a year of energy and effort focused on maternal and newborn health? Our first priority is to emphasize women's autonomy. Women must be able to decide if, when, with whom, and how to have children. That means access to contraception without barriers. It means safe abortion without shame. It means respectful, informed care in prenatal care and in childbirth, and it means emergency newborn care and care for children, including nutrition support, immunization, and more. And here I want to highlight the green wave, La Marea Verde, that's transformed the abortion rights landscape across Latin America. This movement, led by women, health advocates, and human rights defenders, has achieved historic wins and has ignited a conversation across the region and indeed across the world about bodily autonomy, justice, and equality. And this leads us to better outcomes for maternal and newborn health. They've shown that change is possible, that women organize, lead, and demand their rights, and lives are saved. And healthcare systems, healthcare actors, advocates, policymakers can support these rights. Our second priority is to invest in people and systems. That means training and supporting midwives, nurses, and community health workers to authorize task sharing and task shifting. It means ensuring that facilities have the supplies, systems, and supervision that they need to support their healthcare workers. And it means using data, not just to report and count what's being done, but to use data to learn and to improve. It's quality improvement across the sector. Finally, it means being accountable to the people and communities that the system is serving. And our third priority is to shift norms and center equity. Too many women avoid prenatal care because they were shamed, maybe after a miscarriage, maybe while they were trying to access family planning. Too many girls grow up without education about their bodies. Too many boys grow up without the respect they need to have for their sisters, their cousins, and other girls in their communities. Too many survivors of gender-based violence are left unsupported. And health systems can't be effective if people don't trust them. So trust comes from listening, from safety, from equity, and from the quality health services and healthcare that can be provided when we do the work and address the root causes and barriers together. So what can we do? In fact, what must we do? We must fund sexual and reproductive health, maternal and newborn health, and community strategies to increase information, to increase education, to improve care. We must do this because we're not only facing a health crisis, we're facing a coordinated backlash against reproductive rights, against women and girls, and against bodily autonomy and against progress. We must remove the legal barriers to care. We must remove the barriers that keep people from having access to the information, education, and support that they need. And we must expand postpartum and post-abortion care, including with postpartum and post-abortion family planning. This is a concrete area that touches maternal as well as sexual and reproductive health, And it can rally a wide range of providers and policymakers and make a real immediate difference to women. Ensuring access to post-abortion and postpartum family planning and universal health coverage and primary health care is a core strategy that we need to embrace and advance during the year. You'll see we posted a white paper here on our website. We can provide the link. We also must stand up for reproductive rights. We cannot take reproductive rights out of the equation if we care about maternal health and newborn health and child health. This is not just about health systems. This is about justice. This is about freedom. This is about dignity. We want healthy beginnings. We want hopeful futures. That is our theme for the year. We will carry that through. So we must give girls and women what they've always needed: respect, rights, and real choices. I thank you very much for inviting me here today. I thank you for the work you do every day. And I thank you for supporting and advancing the rights and the health of women and children on World Health Day and every other day of the year. Thank you.
Thank you, Tracy, for your inspiration. Thank you very much for your participation today. Following our program, I invite our colleague, Jenny Creswell. Sabemos que poner fin a la mortalidad
We know
materna y
that
neonatal
ending maternal and neonatal
es un llamado
mortality
que hace la
preventable
Organización
is a
Mundial de
call
la
that
Salud
the World Health
presente
Organization makes en masse
incrementar los esfuerzos de
in order
garantizar el
to
acceso
expand
a una
uh,
atención
measures to
respetuosa
guarantee
y de
access
calidad
to
para las mujeres
respectful
y recién
and
nacidas,
quality care for women and
especialmente en los países más pobres y en las
newborns, especially
situaciones de
in the
emergencia
poorest countries
en
and
que
in
se
emergency
producen la
situations
mayoría de las
where
muertes.
most deaths occur.
Invitamos a
We
Nora
now
Moreira,
invite our colleague,
científica de la Organización Mundial de la
scientist from the
Salud,
World Health
que trabaja en
Organization,
el
who
Departamento de
works
Salud
in the
Sexual,
Sexual
Reproductiva e
Reproductive
Investigación, que
Health
incluye el
and
Programa
Research
Especial de
Department, which includes
Investigación
a special
y
program
Desarrollo de
on research,
Capacitación
development, and
en
training
Reproducción Humana.
in human reproduction.
Jenny se
Jenny
especializa en la
specializes
medición y
in
estimación
measuring
de la
and
mortalidad
estimating
materna
maternal
y
death
otros resultados
and
de
other
salud
outcomes from
sexual
sexual and
y
reproductive health.
reproductiva. Jenny va a
Jenny will
presentarnos como
now present
parte
to
del
us,
objetivo de
and
esta
this is part
reunión,
of the goal
el
for this
lanzamiento
meeting,
de las
and
nuevas
this is deploying
estimaciones
new
que el Grupo
estimates
Interagencial
that the interagency
desarrolla
group develops
periódicamente.
on a periodic
Jenny,
basis.
welcome. The floor is yours. Thank you.
Thank you, Rodolfo. I hope you can all see my screen. Good morning. In this brief presentation, I will be presenting high-level findings from a new UN interagency report into maternal mortality levels and trends, which has been published this morning. This report is a collaborative effort. There are several UN agencies involved: WHO, UNICEF, UNFPA, the World Bank, and UNDESA Population Division. And we work together to produce global, regional, and country-level maternal mortality estimates for the years 2000 through to 2023. Our work is informed by an independent technical advisory group, which is multidisciplinary. It includes demographers, epidemiologists, statisticians, and also clinicians who provide us with independent expert guidance into the methods and how to interpret the data. This is the 11th report in a long series of maternal mortality estimates. This has been produced by the UN dating back to the mid-1990s. And it builds upon previous reports and estimation methods to improve accuracy and data use at the country level. The headline finding, the top finding, is that maternal mortality remains unacceptably high. And it is unfortunately one of the indicators which has the biggest inequalities between countries and also within countries. As you will see very visually on this map, globally, the burden of maternal mortality falls very heavily within sub-Saharan Africa, with 7 out of 10 maternal deaths globally taking place within this region, which is indicated by the darker blues in the center of this map. Because these estimates are produced within the UN system, they undergo a rigorous country consultation process so that we can discuss the data, the methods, and how to use the data with countries to ensure maximum impact. The latest set of estimates includes 5,727 country years of empirical data from countries, covering the period 1985 to 2023. As you can see from the pie chart on the right, the majority of data inputs do come from civil registration and vital statistics systems, just over half the data we have, followed by population-based household surveys, for example, such as the demographic and health surveys. However, it's important to note that there are important regional variations in data availability and also data quality. In sub-Saharan Africa, where the burden of maternal mortality remains the highest, there is also the least data and the least high quality data, with data often coming from population-based surveys or censuses rather than civil registration. So where are we now, or where are we in 2023, the last year for which we estimated? Globally, we estimate that there were 260,000 maternal deaths in the year 2023, and that corresponds to a global maternal mortality ratio of 197 maternal deaths per 100,000 live births, equivalent to 712 maternal deaths taking place every day, or approximately 1 every 2 minutes. As I've already mentioned, sub-Saharan Africa accounts for 71% of maternal deaths, and this is followed by Central and Southern Asia with 17%. In Latin America and the Caribbean, there's just under 3% of maternal deaths at the global level. You can see on this graph on the left that we see very, very substantial differences between regions in the lifetime risk of dying, which is defined as the probability that a 15-year-old girl will go on to die from a maternal cause during her lifetime. In sub-Saharan Africa, that risk is 1 in 55, whereas in Australia and New Zealand, the region with the lowest lifetime risk globally, the risk is 1 in 21,248, approximately 400 times lower than in sub-Saharan Africa. A really huge gradient, which is tragic because nearly every maternal death is preventable. This slide gives you an idea of the regional trends. You will see that globally between 2020 and 2023, the global MMR fell by 40%, which is good progress. And there were declines in nearly every region. You'll see that sub-Saharan Africa, despite having the highest burden globally, did make good progress throughout this time period. The annual average rate of reduction in the maternal mortality ratio between 2000 and 2023 was 2.2%. And the number of maternal deaths fell significantly from 444,000 in 2000 to 260,000 in the year 2023. You can see across all regions, there was an increase coinciding with the COVID-19 pandemic, but that now in 2023, maternal mortality levels have resumed previous trends predating the pandemic. For the first time, this report provides insights into the impact that the COVID-19 pandemic had on maternal survival. We estimate that globally there were around an additional 40,000 deaths in the year 2021. And this upsurge was linked not only to direct complications caused by the virus itself, but also from widespread interruptions to maternity care and safe delivery services. The report also provides insights on maternal mortality in humanitarian and fragile contexts. In the 37 countries globally, which the World Bank identifies as being affected either by conflict or by high levels of institutional and social fragility, 6 out of 10 maternal deaths occurred globally. The maternal mortality ratio for the group of conflict-affected countries and territories was 504 maternal deaths per 100,000 live births, which is significantly more than double the global average. In terms of progress towards Sustainable Development Goal 3.1, substantial shifts in focus and investment are needed now if the SDG target is to be met by 2030. You will remember that earlier in this presentation, I shared that in 2023, the global maternal mortality ratio stands at 197. Our target for the year 2030 is a global MMR below 70 maternal deaths per 100,000 live births. If we assume that the rate of progress between the year 2016 and 2023 continues, the maternal mortality ratio would be 177 in the year 2030, 2.5 times above the SDG target. In order for us to achieve the SDG global target by 2030, we would require an annual average rate of reduction of nearly 15% throughout the years 2024 to 2030, which is unprecedented. You will remember from my earlier slide, the rate that the world achieved in the first 2 decades of this century was 2.2%. Thank you for your attention. It's been an honor to be with you today, and I will hand the floor back to my colleague Rodolfo. Thank you very much.
Muchas gracias, Jenny. Muchas gracias por la claridad. Invitamos
Thank you,
a los
Jenny.
casi
Thank you
600
for
ya
your
cercanos
clarity.
participantes
And so
a
we
leer
invite
el documento y a poder
all the
analizar
participants to read
este
this
último reporte
carefully,
de
this
la
latest
mortalidad
report
materna que
about
hace
maternal
el prestigioso
mortality
grupo interagencial.
that is
El
in
material
charge of the
está disponible
interagency
y liberado hoy
group, a
para ser
prestigious group.
lanzado a nivel
And
mundial
the
justamente
report
en este día.
will be launched
El documento va a
exactly
estar
today.
liberado para que
The
cada uno de ustedes
document
pueda
will be
bajarlo en su
free,
computadora, puedan leerlo,
will be access free,
compartirlo, poder
so
tomar sobre
you
todo
can
las
all
acciones para
download it and
acelerar
read
la
it
reducción de
and
mortalidad
contribute
basadas en
to
los
the
datos de cada
actions to
país.
reduce the mortality
Pasamos
rate in all
a la
countries.
última actividad de
And
nuestra
we'll now
mañana,
go
que es
towards the
el
latest
panel.
the last activity in this panel.
Gracias, Tatiana, por compartir la presentación. Eso, gracias.
Thank you,
Donde
Tatiana,
van
for
a ver
sharing the
las
presentation,
perspectivas
where we will
países.
discuss
Hemos
the
invitado
perspectives from
a
different countries.
la
We have
doctora
invited
Susan Cerrulla,
Dr. Susan
jefa de la
Cerrulla,
unidad
who
de
is the
salud de las
head of
mujeres
the
materno,
neonatal,
neonatal y reproductiva.
maternal and
Tiene
reproductive health,
más de 17
and
años de
she has
trayectoria
more
dentro de
than
la Organización
16
Panamericana de la
years of
Salud en
trajectory
el área
at
de salud
PAHO
sexual y reproductiva, sin
in the
hablar
area
de
of sexual and
ginecología y
reproductive
obstetricia,
health,
doctorado
and
en materia
very
de
long experience
embarazamiento.
in
Podemos
gynecology
mencionar
and,
además
and
que está
obstetrics.
enfocada justamente
She is
en el
also
empoderamiento de madres
focused on
y salud
strengthening
de las mujeres,
the area of
integrando los sistemas de
women's
salud
health,
basado en el
integrating
enfoque de
them
atención primaria.
into
La doctora
health
Cerrulla va a
systems
coordinar el
based on the
panel para la
primary healthcare
participación de 4
focus.
ministros de salud de
It's
nuestra región que representan
ministers of
cada una de
health
las
who will
subregiones de la
present their
Sudamericana de la Salud.
sub-regions,
Susana,
their respective sub-regions of
adelante.
at PAHO.
Muchas gracias,
So,
Rodolfo. Muchas gracias,
Suzanne,
Tracy y
go
Jenny,
ahead.
por sus excelentes
Thank you,
presentaciones
Rodolfo,
y
Tracy, and
muy
Jenny, for your excellent
bienvenidas
presentation.
las 4
And
mujeres que hoy
welcome
representan
to the
los
4 women
4 países
who
de los
today
cuales
will
vamos a escuchar
represent the 4
qué
countries.
innovaciones, qué
We will
políticas
hear
han
what
logrado
innovations and what
implementar
policies
para
they have been
mejorar en
able to
cada uno de
implement
esos 4 países tan
to
diferentes la
improve
vida de las mujeres y de
the
los
life of
recién
women
nacidos, los y
and
las recién nacidas.
newborns in their
Nosotros
respective
tenemos
countries.
un tema muy especial. Es la
We
primera
have a
vez
very
que tenemos
important
un Día
issue
Mundial de la
in
Salud
hand
dedicado a la salud
because
materna
this is the
y la
first
salud
time
neonatal,
that
donde nosotros
this
hacemos hincapié
World
que para
Day
los comienzos
Health Day
saludables
is
de una
focused on
maternidad
maternal and
y de
newborn
un
health.
bebé es necesario tener
This is
futuros
very important
esperanzadores
because
para
this
los
leads
dos.
to hopeful
Porque lo que
futures
nosotros
both
buscamos en
for
las 4
women or
mesas
mothers and children.
de este día, de
And
esta celebración, que nos
during this
destina hoy todo
celebration
lo
and these
contrario.
4
Esta es una
presentations
celebración diferente. La OMS, las otras
shows
agencias, PAHO, han decidido
that
que será
other
todo un
agencies at
año de
PAHO
actividad, como lo que Jenny acaba de presentar,
will
porque
dedicate this year
precisamos
to all the
acelerar la reducción
activities
de
we
la
have planned
mortalidad
in order to
materna
reduce
en todos los
maternal
países.
and
Pero
infant
buscamos
health in
4
all
cosas.
countries.
Primero,
We
poner
are
fin
looking for
a
4
toda la
things:
mortalidad
to
materna
stop
y
all
neonatal
the
prevenible.
maternal
Lo
and
podemos hacer
neonatal
porque
health
ya tenemos
cases.
el
We can do
conocimiento
that
y las
because we have
herramientas
the
para hacerlo.
knowledge and the tools to do
Nosotros
it.
necesitamos
we need to focus on women's needs that go beyond the mere survival. And we believe that the access to the benefits of sexual reproductive health are the ones that support these actions. It's necessary to insist on all aspects. We have clearly seen that these are benefits for the whole society. And we need the whole society to implement this change, and it will benefit the whole society. The maternal mortality is social injustice, and we have to change it. So we will start with a with a country that is very dear to me, where I lived for 16 years. So we invite Dr. Cristina Lustenberg from Uruguay. She is quite an inspiration for all of us if we look at her CV. And she's very focused and very much linked to this day because she is in charge of the program Uruguay Grows with You, that is focused on the development of children and the health of mothers. Thank you very much. Go ahead. Good morning. And Dr. Susan Cerulla, it is a great pleasure for me to see that you are heading this panel. And we want to thank the whole technical team of PAHO, the subdirector, and all the panelists. We are very happy to be in this panel together with the ministers from St. Lucia, Nicaragua, and Peru. And I started my new job on March 1st. You know our country, and thank you all. I don't see you all because not many of you have your cameras on. But I'm very happy to hear you. And so I'm accompanied by two colleagues here in our ministry, two epidemiologists that are part of our of the team directly under our supervision. And I'm accompanied by our representative of PAHO in our country. And we are 5 here around this table, and we will listen very carefully to all presentations. I will tell you that neonatal and maternal health have made some progress in our country. We have been able to implement the different strategies in each one of the programs. And all these are linked, the deaths linked to maternal health have gone down. This is one of the best indicators to show the degree of development of a country focused on public health. As you said, Suzanne, the WHO has focused on public policies of health linked to maternal and neonatal care. And we have implemented such a program in our country, focusing on the main causes of maternal death, abortion in unsafe circumstances, and complications after childbirth. 53 of each of 100,000 newborns is our current data, and maternal health has also diminished. And the idea is to diminish the causes for maternal and newborn deaths further. law, there is a new law about reproductive health, sexual and reproductive health for the Uruguayan population, and the state is obliged to to care for both. So the integrated health system provides a broad choice of anti-conceptive means, and also a free of charge care for mothers and children, both in the, well, public and private system. Because the private system is financed by public funds. And cares for the Uruguayan population by providing well-qualified professionals, and a specific module for morbidity and mortality related to obstetrics. And there is also a vigilance system about mortality with public reports annually, and monthly reports of women's deaths during childbirth. And this analyzes the system analyzes the 100% of all cases of maternal deaths occurred in our country, and this is part of our health system. Here, a manual for mother and child care, and we have presentations and manuals for training of the staff tending to mothers and babies, and all mothers or all pregnant women are vaccinating on RSV, and as I said, starting on March 1st, we are focused on improving inequality. That is, we have indexes for human development by region, by income, by territorial areas. We still have inequalities based on gender and race. So we are focused also in reducing maternal health based or this due to hemorrhage, and so we try to provide better care for mothers and children in both the public system by focusing on that, and facilitating access also to the migrant population, because this is also a challenge we have here because of the migrant population. We are facilitating this type of care also to this population, and through the reports of maternal morbidity, morbidity and mortality, we are focused on diminishing this rate constantly. And for 2 years, we have been focused on reducing maternal mortality and providing contraceptive care. And the rate of birth diminished during these past years because we had 16,000 births less than in 2022 because, and this is not bad news because we are focusing on improving the conditions in which maternity, and we want our women to choose if they want to have children or not, and so we provide free contraception. Before, Uruguay had inadmissible rate of pregnancy in teenagers, and so we started with this policy that we share with other countries in the Southern Cone in order to really reduce these figures because we were really ashamed of them. And so we had 1,500 fewer births than the past year. And so if we put this together with the figures of maternal mortality reduction, we are making progress. We're also reducing the rates of adolescent maternity. We still have cases of pregnancies in girls under 15 that are related to inequalities, and 60% were.
Un minuto, ministra. Gracias.
Yes, you have 1 minute. Uruguay has a lower number of births and also of mortality. And now we have an indicator of 6.5 of infant mortality, and the mortality in women, in pregnant women, we are focused on reducing the mortality in pregnant women by facilitating abortion. And because these rates are based on socio-environmental factors, so we have many challenges before us, and well, we have to leave you now because we have to continue with our work, but we will keep this issue on our agenda and we'll continue facilitating programs focused on perinatal care. And our country is also committed to an integrated healthcare system to strengthen this program that we are calling Uruguay Grows With You. And this is a public policy that involves actions that reach out to all adults and children so that they can children when and in the way they want them. And this will require investments and cooperation among sectors, and because we have to work with the rest of the institutions. Well, this issue is very important for our ministry. Thank you very much for allowing us to share our results with you, because we do have challenges still ahead of us, but we are making progress. Thank you very much, Minister. Uruguay is one of the countries with lower rates, with the lowest rates in the last 10 to 15 years in neonatal and maternal deaths, and with the best legislations in that sense. So listening to you gives us a chance to see what countries can do. Thank you very much.
Because it's my pleasure and honor invite Dr. Alicia Eugene Ford from St. Lucia to present her experience. He had a large CV, of course, and also he is responsible for for implementation a very innovative program in St. Lucia. So, Dr. Alicia, the floor is yours. Please go ahead.
Thank you, everybody. I want to wish happy World Health Day to everybody. I first want to apologize on behalf of our Minister of Health, Wellness and Elderly Affairs, Honorable Moses Jean-Baptiste, who would have loved to be here at this meeting, but he is otherwise engaged at an equally important meeting. A little bit about St. Lucia and to say about our program when it comes to our women and children, our babies. In St. Lucia, the pregnant women are able to access services at the wellness centers with no out-of-pocket payments, as the visits are free. However, the diagnostic services such as laboratory investigations and obstetric ultrasounds had to be paid out of pocket. As of June 2023, the Universal Health Coverage Project, or UHC project, provided free laboratory tests and ultrasounds at no cost to pregnant women through the wellness centers, or what we call our primary care facilities. In order to launch this service, the Universal Health Coverage Unit embarked on an intensive consultation campaign to sensitize all stakeholders on the UHC initiative and to get feedback in order to further identify gaps and to obtain recommendations on the way forward. The stakeholders engaged included the Ministry of Health strategic management teams, clinical teams at the primary healthcare, the hospital setting, and the private sector. We also brought in private sector laboratories and imaging study agencies. We also brought in the St. Lucia Medical and Dental Association, private obstetrician gynecologists, and we liaised with PAHO in the person of Dr. Solaj Kobe Jackson, amidst others. Additionally, a series of public consultations were held in both Creole and English using various print and social media, television shows, and community meetings. This initiative allowed the training of staff in both the private sector and the public sector in the management of obstetrics and neonatal complications. We did Lamaze classes again, especially for the nurses in the antenatal care, patient satisfaction as well, development and reviewed our standard operating procedures across facilities. We developed key performance indicators, and we expanded and enriched our perinatal monthly meetings, which usually occurs between primary health care, the hospital, and the private sector. And of course, because of this initiative, we developed and in some cases strengthened our public-private partnerships. Our data so far shows that during the period when we started from June 1st, 2023 to December 31st, 2024, we had about 2,200 expectant mothers accessing the services through the Wellness Center. We had about 2,200 women, of course, receiving the lab services, and more than 3,300 ultrasounds were done for that period. We also extended this service to the private sector physicians because we felt it was necessary that even though an expectant woman had a relationship with a private physician, we didn't want to stop that relationship they have with the private physician. So therefore, we would have allowed them to come into the primary healthcare to access these free diagnostic services at no cost to them. Currently, we are delving into our data. We're measuring our key performance indicators as we noted that our perinatal outcome is not really where we want it to be, particularly after we have provided the free diagnostic care. So therefore, the research is looking to why our perinatal outcome has not increased. Improved, sorry. There must be reasons why it has not improved other than just providing the diagnostic care. And therefore, we are steadily looking into why our decline in our overall births, which is also another thing we're seeing, but why the perinatal outcome has not really improved despite the free diagnostic test. And of course, the results coming out of that research will allow us to make robust recommendations and for policy decisions, and in cases to do what you call ensure we have appropriate actions. I had also shared with the team, PAHO team, on an ad that we had developed. I'm not sure if it is going to be placed right now and showed to persons on this webinar, but I did share and I would like, I'm not sure if it's on, but the ad is done in English, but because St. Lucia we bilingual, it's also done in English and French Creole. Thank you.
Thank you so much. You are ready for your video. Thank you so much, Dr. Alicia.
Sorry, the
No
audio
volume.
share.
Néstor, ¿tú puedes ayudar para incrementar el volumen?
No se escucha nada. Yo no puedo hacer. Ella tiene que en su computadora.
You would have to turn on your sound on your computer because we cannot hear it.
Pedimos disculpas por este inconveniente técnico. De todas maneras, este video va a quedar disponible para que todos puedan mirarlo y escucharlo.
This video will be available for all of you to listen and hear to it, but we do not have time left. Thank you very much,
Let me
Alicia.
take this opportunity for remember all of you that this is a webinar that will be in your YouTube channel, PAHO channel, so everyone can come back and see. Just because today in many countries, in the most of countries in our region, we have a celebration. And as Dr. Cristina said, we have in each country another activity. So you know that after all, we can consult this video, but I apologize for this. So now you go, vamos directo a Nicaragua. Uno de los países
We'll
que
now
tiene
go directly to Nicaragua, which is one of the countries that has successful experiences
dentro de su realidad, un
within its
conjunto
reality
enorme de implementaciones bien
with
sucedidas. Yo
a
tengo el
lot
honor de
of
presentarles
very
a la doctora
successful
Maribel
measures. I want to
Hernández
introduce
Muñoz,
Dr. Maribel
que es no
Hernández
solo una
Muñoz.
especialista en nuestra área,
She's not only a
pero
specialist
también
in
es
our
una
area of work,
ministra de
but she
salud,
is the Ministry of
bueno,
Health.
una referencia al actual ministro de salud, y es de
She was the
donde
Minister
nosotros
of Health,
tenemos
and
la oportunidad de escuchar. Por favor, doctora
so
Maribel, muchas gracias
we
por
will be
estar
very
con
happy to
nosotros. Yo
listen
sé
to
que
her.
también
Thank
Nicaragua
you,
tiene
Dr.
hoy
Maribel. I
celebraciones
know that
y usted puede empezar su
celebrations today,
presentación.
so we look forward to your presentation. Good morning. Thank you very much for the invitation to our country to share our experiences in what has been a constant fight to reduce maternal and neonatal health. Nicaragua is in the midst of Central America. We have around 7 million inhabitants, and I need to tell you about the political organizations because our country is divided into 19 regions, and the functional unit of the ministry are the teams of family and community health. We have about 2,665 teams that are led by a physician or a nurse, and this organization reaches out to the whole territory, and it has allowed us to achieve success in most of the strategies that we have taken ahead, and it has led us to reduction in maternal and neonatal health. This wouldn't be possible, and it is defined as a priority line by the government of our country. The investments carried out by this policy have improved infrastructure, equipment, and also the training of human resources and the development of the staff that deals directly with women. Not only the midwives, but also the doctors that tend to newborns and provide intensive therapy in critical cases. In this
We
political
also have the support from strategies that have been key to achieve reducing maternal mortality. I will first say that we've defined a route for supporting women that begins from capturing on the ground by health brigades or community leaders, by health brigades who help capture so that women can be included on a census that we call chief pregnancy census, so that we will always have under the Ministry of Health's radar all of those women who become pregnant and who begin their prenatal attention within units. This also has led us to detecting risk with a new strategy we've developed for 2 years, such as comprehensive first trimester screening. Some of you might have heard about this screening that Dr. Nicolas proposed, which detects patients who have a high risk of preeclampsia or preterm childbirth, which is also a cause for neonatal death. And it also allows us to perform follow-up after classification with special care detected during risk classification. Following that route, women within care unit will make their delivery plan so that they may arrive at the facility they will be tended to without complication. And then after 6 weeks, we have a new strategy developed in the last years, such as maternity homes, which are not isolated units, but are located in each of the districts of our country in such a way that at this time we have 182 maternity houses which provide temporary housing to women, which under the criterion of remoteness, we achieved them having access to health services so that they may be referred once they begin labor. That acts in the first and second delays, such as the decision to seek medical attention or the decision to go to health units, which is precisely what has given us success in this significant reduction of maternal mortality, which, as I said, we have 182 maternal houses located in the different municipalities or districts of the country. Then we have other strategies that have turned out highly successful, such as execution of fairs, community fairs, where which are geared at seeking those patients that have not yet reached health services for one reason or another. They have been left behind, and that we have achieved via community networks to capture them and take them to this mode of attention. And to finish, In this cycle of follow-up for pregnant women, we have mega health fairs. Mega health fairs or expos are executed by maternity and fetal experts who move out to selected locations to perform, capture, and cover the comprehensive screening that we mentioned beforehand. The support to the whole pregnancy process of women has led us to these women at 36 weeks with a negotiation process during their pregnancy may access or get to in an informed manner to a maternity house where she expects treatment and beginning of labor and to be referred to a second level unit. If you have the chance to review the health map of Nicaragua, you would see that each of these homes, as we say, we are at the ribs of the health emergencies. We are some steps away, always surveilled by staff, which is designated to the administrative part that performs maintenance to the maternity house and also medical staff that cares for women housed there. I'm speaking of maternity houses because it poses an opportunity for us from 36 weeks to be able to get to women on 7 topics which are very important to us, which is caring for women, caring for children, breastfeeding, and also the decision of planning once pregnancy ends, alarm signs, family integration, caring for the environment, as well as a very important matter such as personal growth of women with gender issues and topics that truly enrich for women to be empowered in their own care and caring for their family, but also on other aspects that we have called entrepreneurship or ventureship, which are occupations learned in these maternity homes. And among the principles in these homes, such as solidarity and also personal growth and care, both for them and their baby, we are able to really achieve a significant impact to Nicaraguan families. This, as I explained, is a route of support that has been set up precisely to be present at each of the moments with our pregnant women up until childbirth. Simply, this would have not been possible without political will nor decisive investment to be able to sponsor all these activities, and apart from having defined the policy of community participation. If we could please mute the microphones. I don't know if I'm on time or there's an open microphone. Apologies, Dr. Maribel, Minister. Somebody opened up their microphone. You still have 1 minute, 30 seconds to go. Go ahead, please. So I was sharing that for us it is very important and it has been definitive among the key elements. One, to have funding and political will from our government. Two, to participate and to have a family and community model where the essential model of health participation are family and community health units as well as GISES, which are comprehensive health, intercultural health groups for special areas. And then we also have this development of community strategies. If we have we do have challenges, though it continues being for us under the framework defined to achieve safe paternity in our country, new duties that must give us, in this case, prevention of all these complications that may lead us, in this case, to maternal death. And so it has been developed, and we are also taking steps to achieve preconception attention that seems very important to us, precisely with a prevention perspective as well as development and strengthening of comprehensive screening of the first trimester that helps risk detection and also to foresee complications in maternal mortality. This is precisely what we are on the way to strengthen and to try to decrease in a more effective manner the avoidable mortality. We were in 2007 had 98 women perish, and last year we wrapped with 21 women perished. Unfortunately, what we are still on the battle day to day to achieve a reduction that is more significant of mortality.
Muchas gracias, doctora
Thank you
María.
so much, Dr.
Seguro que en
Maribel
Nicaragua
Shorley from
hay
Nicaragua.
experiencias
There
maravillosas
are
y
wonderful
con mucho
experiences,
éxito. Yo tuve el
and as
placer de
always, I
estar ahí
repeat, I had the
con
pleasure to
usted.
be there and with you.
Las casas maternas son un
Maternity
ambiente que
hauses
muestra cómo nosotros
and
podemos dar la
space which
vuelta,
shows
cómo
how
el
we can
sistema de
turn
salud puede mitigar
things around and how the
temas
health system can mitigate
geográficos
issues
en
that are
nuestras nuevas agendas
geographical,
culturales,
that are on
crecer
cultural
visibilidad,
barriers
oportunidad
to
para que las
overcome that.
mujeres
And it is an
puedan
opportunity for
hacerlo.
women
Seguramente el ejemplo de
to be
casas
able to
maternas
access.
es
Surely, the example of
inmenso.
maternity homes is a
Gracias
major
por
example.
traerlo. Y
Thank
ahora
you
vamos
for bringing it to
a
our
otro
attention.
país.
And now we're
Vamos a
moving to
Brasil.
another country,
Y
Brazil,
tengo
and I have
alegría de
the
presentar
joy to
a la doctora
introduce
Camila
Dr.
Gasparo.
Camila
En ese país
Gasparo. In this
estaba prevista la
country,
participación de la
we
doctora
were
Ana Luisa,
foreseeing
que es la
Dr. Ana Luisa's
viceministra
participation, who's
del
the
área
deputy
en la
minister
cual está la doctora
in the
Camila
area
Gasparo,
that holds
pero
Dr.
la
Camila
doctora Ana
Gaspajo,
Luisa
but
Caldas
Dr. Ana
ha
Luisa
ido a atender
Caldas
el ministro
had to tend to the
las
minister
actividades de ese día. La
in their
doctora
daily
Camila
activities.
va a presentar a
Dr.
nosotros
Camila will
desde
be
su rol
presenting
como
to us
coordinadora
from
de
her role
enfrentamiento
as
a la mortalidad
coordinator of
materna,
combating
los
maternal
avances del
mortality,
país y sus desafíos en
country
las
progress and
innovaciones.
challenges
Por
and
favor,
renewals.
doctora
Please,
Camila,
Dr.
usted puede empezar
Camila,
su
you may begin
presentación.
your
Yo
presentation.
prenderé mi cámara
I
cuando
will
falte
turn on
1
my
minuto.
camera when you have
Buenos
1 minute
días
to
y
go.
adelante.
Good morning and come in, doctor.
Muito bom dia a todas as pessoas que nos assistem, que vieram participar desse momento tão
Good morning
importante.
to
Good
all our
morning to each and
attendees.
every one of you.
At this such important time, first I would like to thank the opportunity and the invitation to be able to participate at this time. I would like to greet everyone on behalf of Dr. Suzanne to say that Minister Alejandro Padilla
Atenção primária não tiveram que atender outro compromisso, mas estamos aqui
They
porque
had
a
to
gente
be
had to
in
tend to
another meeting, but
another
we are
commitment,
here with
falar
this
sobre esse assunto tão
opportunity to talk
importante
about
but we are
this
here because we
important
don't have the
topic.
chance to
I
discuss
would
this such
like
important matter.
to congratulate you to talk about
So
this
that we
topic.
may
It's very
discuss
good to
this
know that we are
matter,
all
and it
now
is good to know that we have you all here
working to reduce the
looking to the
maternal and
importance to decrease
neonatal
maternity.
mortality in the Americas. I would like to say that we have made
We would like to
significant
say that we
efforts
have
in recent
made significant
years
progress in the last year since
with
2011 with the Zagonia
Segonia
network that
network to
attempted to set
try
up a
and
network of
build a
model
model
attention
to meet
which
the
tends to
needs of
women's
mothers
and
and
children's
children. We
needs.
have a
We have a
public
public
health
healthcare
system
system
investing
which
in a family
invests
health
in
strategy
the
as a model
family health strategy
to
as a
provide
model for
primary
primary
care. This
care.
is a priority. This
That
is
is a
our model.
priority
We
to our model.
believe in this
We
model. We
believe in it,
invest in
we
this model.
invest
We
in it, and we
understand that this is
understand
the
that it is the
model
model that
to
achieves
reach the
reaching
places
those
where the
locations where
need
people need
is,
it, where
where the
people are
people
there,
are.
and based on
And
that
with
model,
this model, we are
that
opening
open
the
door
door to
to
the
the
population
population
for
and primary
primary
care is a
health,
venue
where
where
we
we
do
use
the
women's
pour que
prenatal
prenatal
les
care. We
and
enfants
the
we
follow-up
vu
of
support
que
children
children
after
after
they
they
are
après
are
born.
avoir un né,
All the
nous
system.
voyons tout le
This
développement
model
de ce
is going to give
modèle.
us
Pour nous,
important
il nous donne
answers,
des
and we are
réponses
investing in this
importantes.
model since
Nous
many years ago, and we
investissons
continue
pendant
investing in
beaucoup de
this model.
temps.
Of course, there are
Et
challenges
bien
that
sûr,
we are still facing in recent years
nous
that have
n'arrivons pas à
not been
résoudre
solved.
pendant
Brazil
toutes
is a
ces
very large
années.
country
Et
with
nous avons
a
une
population
population
of
de
more
plus
than
de 200 000
2,000 million
habitants,
inhabitants,
200
with
millions
different places,
d'habitants
locations
avec
that differ
des
one from
places
the
qui
other,
sont
with
très
different
différentes
qualities,
les unes
type of
entre
qualities
et les
in
autres.
Brazil. And we
Nous
understand that
avons
now
des
we
populations et nous
need a specific
comprenons qu'il
approach
y a
to meet the needs of
une vue
population with difficult
spécifique.
access and women, children with more difficulties to have the necessary health care in the health systems.
In September in 2024, the Segoya network was updated. We, and with the Ministry of Health, the Aline network, we were updating the Segoya network. The Aline, the name is the name of a woman. She was called Aline Pimentel. She was a woman, a black woman, a poor woman living in a difficult locality, and her life was interrupted during her pregnancy. This was due to a series of issues related to the violation of rights in her life during her pregnancy, and Brazil was condemned in this case, and we thought it was a timely moment to update the Segoya network. We decided to use the name Aline Pimentel for this network to highlight the importance of looking at these populations. Why? Because we understand that Black women, poor women, they need an additional resource, they need additional care, and we need to promote equity so that all these people have access to the care they need. And that's why the network is called Aline Pimentel. And with the launching of this goal, we have discussed, we have developed maternal mortality indicators that were developed, and we see all with this specification of race and color, and we have a specific target for this population. We have the target for 2027 of reducing by 25% the maternal mortality in Brazil. However, we have for the same year, for 2027, of reducing by 40% the indigenous mortality. Because when we analyze, we see that unfortunately, this is a group of women who unfortunately continue dying in our country. So this is a specific target that we have for our country. We think that this is essential to allocate resources where women need them the most. We have still some challenges related to the network itself, how we are going to have all the primary care services, specialized services linked to those women with a guaranteed linkage with a service. And we have brought this inclusion. The Aline network addresses also the regulation, how the regulation of these women is going to be so that they can have a guaranteed access to this specialized care, specialized treatment, outpatient care. All these considerations are brought to the Aline network with the investment made by the Ministry of Health, a specific investment for these services and other types of action. Because we see how this is important. We also have other actions related to facing the maternal mortality that is also linked to contraception. This is also related to maternal mortality. We have decided to increase the access to contraception by women. We have trained nurses, the intrauterine device use, trying to increase the access of women to other contraceptive methods. And we need to improve this access by women in Brazil. Besides that, we have also worked in the creation of a national committee to prevent mortality with different sectors that are outside the Ministry of Health, other ministries in the government, the social participation. And in this social participation, we would like to highlight the importance importance
de trazer, ouvir as mulheres,
of
né? Ouvir as
listening to
organizações sociais que
women,
têm as
listening to
mulheres
social
pretas
organization
desse país, as
formed
mulheres
by Black
indígenas. Então, é
women,
importante
indigenous
que
women,
elas
and
sejam
also to highlight
ouvidas.
how
Para
important it
finalizar, eu
is
quero
to
agradecer mais uma vez a
listen to these
oportunidade, dizer que eu
women.
estou
Once again, I
aqui
would like
com a
to
Renata Reis,
thank
que é
you
a
for this
coordenadora
opportunity. I am here
geral de
with
saúde
Renata
das mulheres
Reyes.
do
She is one
Ministério
of
da
the
Saúde,
coordinators
a
in the
Shane, que
Ministry
é
of Health
assessora
for
da doutora
Women.
Ana
Tene,
Luísa,
she
e
is the
dizer que nós estamos à disposição,
advisor
muito
of
felizes
Dr.
por poder
Annalisa,
participar
and
desse
we are
momento
really
e
willing to
agradecemos a oportunidade.
participate in this meeting. And we thank you for this
Muchas
opportunity.
gracias, doctora Camila. Renata y a
Thank
otra
you so
colega,
much, Dr.
nosotros
Camila,
sabemos el
Renata.
enorme desafío que tiene el Brasil, un país
We know
de
the huge
dimensiones
challenge that Brazil
continentales
has,
con
a
tan diferentes
country
áreas
of continental
y con
dimensions with
muchas
so many
barreras, pero
different
también
areas and many
conocemos la
barriers,
decisión
but
política
we
y
also
la
know the
fortaleza
political
del equipo
decision and
técnico
the strength in the
representado aquí.
technical team that I
Muchas
see
gracias por su
represented here. Thank you so
participación
much for your
y nosotros
participation,
esperamos
and we hope
ese material estará todo en la página de
these
la
materials
OMS.
will be
Me
posted
permito
on
ahora
the PAHO
compartilhar con
website.
ustedes
I will
una
now share
de
with
los
you
códigos QR que nosotros tenemos,
one of the QR codes that
mostrarlo,
we
no sé
have.
si ya empieza a aparecer,
I
Rodolfo,
don't know
tú
if it's
me
showing on
avisas.
screen. You can let me know,
Sí, está en modo
Rodolfo.
presentación.
Solo
It should
falta
be in
poner en
presentation
modo
mode.
presentación. Ve si lo consigo hacer desde aquí. Y con eso, y nosotros, ¿y por qué traigo eso? Tenemos en todos los idiomas de la región y la idea
And
final de que
so I'm
ustedes
showing this
puedan
because we have it in all
conocer,
languages of the region, and
tenemos
the idea is
aquí
so
en
you
portugués,
may
que
get to
acabamos de
know.
escuchar Brasil,
Here we're showing in
pero nosotros lo
Portuguese, as we have
tenemos en
just heard from
español
Brazil,
y
but we have it in
tenemos
Spanish and
en
we
inglés.
have it
La
in
idea
English.
central
The main
de
idea
traer ese llamado
in
Brasil
bringing
Vivo
this
y el
call
código
to
QR es
action,
para que ustedes lo
the
puedan
link in the QR
tomarlo en
code
el
is that
celular,
you may
pero
scan it from your
principalmente
phone, but
para decir que
mainly
hay
to
más
say
de ciento
that
y no sé cuántos comentarios que dicen, haga
there's
una
hundreds
página
of
con
comments
buenas ideas.
saying,
Bueno, nosotros tenemos. Yo
make a
les
web page with
invito
good
a
idea. Well, we
conocer
have it. I
las
invite you
páginas.
to get
Y
to
aquí
know the web
pequeñito, antes de
pages.
empezar el resumen
And
y las palabras
before
de cierre
beginning the
que
summary and
tengo el honor
closing
de hacer,
words that I
es
have the
decir que
honor
desde
to
esa
provide,
nueva
I would
unidad,
like to say
nosotros
that from
somos
this
una
new
nueva
unit, we
unidad
are a new unit
que
which
que ha sido la
is
transferencia, que ha sido
has
el
made the
resultado
transfer that
de
has
la
been the
transferencia
outcome
del
of the
Centro
transfer
Latinoamericano
of
de
the Latin American
Perinatología a
Center of
Washington, a lo que
uh,
nosotros llamamos headquarters
Perinatal
de la
Health in
organización.
Washington.
Uno de los cambios definitivos,
One of
esta área que se
the
pasa a
definitive
llamar
changes is
salud
that
de las
this area will
mujeres
now be
y
entitled
va más
Women's
allá
Health, and it
también
goes
de lo que es la
beyond
reproducción. Hoy estamos muy
reproductive
enfocados
issues
en el tema
also.
de la
We are
mortalidad
pretty much focused
y que,
on
como hemos
maternal
hablado,
death
ese es un tema
because, as we
que
have discussed,
es una de
this is a
justicia
matter
para todas las
which
mujeres.
is a
Y
matter of
si me
justice to
permiten
all
ahora
women.
hacer un
So,
pequeño
if you
resumen.
allow me
En
to
primer
provide a brief
lugar, no
summary
tengo
first,
palabras para
I have no
agradecer a
words to
Tracy por
thank
su excelente
Tracy for
exposición,
her excellent presentation,
donde ha logrado en tan poco
where she
tiempo
has achieved
mostrar
in such little
que los
time to
gaps
show that
llegan
the
las mujeres
gaps,
más vulnerables y mueven
this is
valores
where
que
we
son
get most
definitivos
vulnerable
para
women
nuestra
moving
sociedad,
definitive values to all
como la
society,
autonomía, la
such
dignidad,
as
el trato
autonomy,
respetuoso,
dignity,
y que sí,
respectful
nosotros
treatment,
podemos
and
hacer
that if
donaciones que hagan
we
un
can
cambio
make
eso. Si somos capaces
donations
de investir en personas,
that
si somos
achieve
capaces de
changes, if we're
investir en
able to invest in
estrategias como
people
task
and able to
sharing,
decide on
que es
strategies such as task
la
sharing,
formación de equipos
which is
interprofesionales,
training interprofessional teams
multiprofesionales,
and
cada país tiene un
multi-professional
nombre,
teams. Every country has
y
a name.
nosotros somos capaces de
We are
hacerlo en
able
sociedad y hacerlo.
to
Y trajo una frase que
overcome
me
that as a
impactó mucho,
society. And
que
she
dice,
brought
el
a
silencio es
phrase
una barrera.
that touched me
Porque
a
las
lot, and this
mujeres
is
que
that
tienen
silence
menos
is a barrier
voces
because
en
those
la
women
sociedad,
who
y
has
ahí
less of a voice in
encontraremos a las
society,
mujeres
and there we
que
will
son más
find those
vulnerables.
women who are
También
most
nosotros
vulnerable.
tenemos aquí
Also, we
algo
have here
porque
something
presentó Jenny,
on
mostrando
which
que eso se
Jenny
traduce
presented, showing that
exacto lo que
this
hemos hablado.
translates exactly
Primero,
into what
Tracy, Jenny muestra en
Tracy
números.
shown. First, Jenny showed
Desafortunadamente,
in numbers,
61%
unfortunately,
de
61%
toda la mortalidad del
of
planeta está en
all
37
global
países.
mortalities in
Y
37 countries.
aunque el número de las
And
embarazadas
though the number in the
parezca
Americas
poco,
might seem
menos de
low,
3%,
less
yo
than
puedo decir que
3%,
para
I
cada
would like to
familia
say that to
ese
each family,
1% es la
that's
mamá.
100% This family, it's the mother, it's the baby, the family breaking, so we need to work on tirelessly so that this region has a rate that is equal to the development that exists. As we are a region that is developed and we have inequalities, we have much, but we are able to do it. And then we had the privilege to have four women from Uruguay, St. Lucia, Nicaragua, and Brazil telling about all tools, policies, and the struggle in each of those countries to avoid us having more maternal deaths. We would like to achieve SDGs. Yes, we do, but also and fundamentally, we would like to fulfill the promise of the Americas, or for the Americas, with a future that upholds reproductive and sexual rights. Thank you so much for being with us. We finished this webinar with more than 600 people. This is not on, oh, it is posted on the YouTube Pajo channel, Pajo YouTube channel. We will now be playing a video with sound, hopefully from St. Lucia. Please stay to watch the video from St. Lucia. Thank you, everyone, and especially to all the team behind the scenes. I will not give names, I will merely give the leader at Washington, and this has been Rodolfo Gomez and all his team, Maria, Thais, and everyone. It would take me too long to mention each and every one of you. Thank you so much, and we will meet again soon.
Diana, por favor, si pudiera compartir el video. Gracias.